Hello, my name is Peter Walker-Birch and I'm here again with the fourth video podcast for Clinical Placement 1. Now I hope that you have all had another successful week in clinical practice. I hope that you like the Blockbusters theme at the beginning of this video podcast. Again, this is another Peter and Alexander Walker-Birch production. Now you probably won't recognise the theme, as Blockbusters was a tremendous hit back in the early 1980s. And you were all probably not born back then, which makes me feel really old. Now it was hosted by the legendary Bob Holness, who sadly died in 2012. And yes, there is a striking resemblance to Mr. Robert Dash. Now the aim of the game was to test the theory that two heads were better than one, with a team of two taking on a single opponent. Now the contestants would identify a letter on the board by saying, "Can I have a W, please, Bob?" Many of us less mature-minded students would revel in the smirking when the inevitable "Can I have a P, please, Bob?" got asked. Now, Blockbusters had a massive cult following from students, and I, for one, loved watching it when I got home from school. As you can see, back in the 1980s, I could quite a dashing figure, not, in my naval uniform when I was a student at a prestigious nautical school in Hull, called Hull Trinity House. Now the reason for the Blockbuster clip is that I have taken some time to create a Blockbuster style quiz for you to engage with. Actually, there are 3 quizzes, all on radiographic and clinical terminology. Now the first quiz has been voiced by both Alexander and myself, with Alexander asking the "Can I have a P please, Bob?" question. We had to do a number of takes as he found it just as amusing as I did when I was a spotty teenager. Now the other 2 quizzes I haven't had the time to voice at all, so many apologies. So make good use of the pause button. Please take the time to have a go at them. There are about 60 questions in total, which should go some way to helping you improve your knowledge of radiographic and clinical terms. I shall be putting the answers up in the next week or so. Can I just say thank you for the lovely feedback that I have received about the video podcasts, by the way. I really appreciate your comments and encouragement. I am pleased that you are finding them useful too. And Alexander would like to say thank you to Katie Robinson for the lovely tweet that he received, thanking him for his Doctor Who contribution last week. I have to say that I've had a few requests today for possible podcast themes, so it looks like I'm going to be busy for the rest of the placement. Now I've been out visiting lots of students today as a visiting lecturer. I managed to get to both Blaydon and Trinity Health Centres in Gateshead and also to the RVI in Newcastle. Now it was lovely to see so many friendly faces enjoying their time as student radiographers. I have to say that I'm really pleased with the feedback that I'm getting about you all from clinicians. They are really impressed with your work ethic, your confidence and your ability to put patients at ease. There are some clinicians that cannot believe that you're only 4 weeks in. This is tremendous news and I'm really proud of you all, so please keep up the excellent work. If you hadn't had a visit from your visiting lecturer yet, don't worry, as you should be getting a visit soon. Just drop your visiting lecturer a line if you're not sure when exactly it is they're turning up. Now I'm officially on call this week and next week, so if you have any problems at all, just call the on-call number, which is 07528 183 964. Now the focus for this week in the module guide is on alternative projections and alternative modalities. I would start to keep a log of all the different projections that you do, particularly ones that go beyond the typical AP and lateral projections. What about alternative projections for the knee, for example? When is a scarlet patella carried out? You might want to look at tangential projections of the knee to find out a bit more, as there are a number of projections that can be used, like a Merchant's projection, or a Houston projection, or a Lauren projection. Now please take careful note of radiology requests, electronic or paper-based, or radiology reports from RAIS or PACS, as follow-up imaging, alternative imaging, or alternative projections are often suggested. Another important source is the departmental protocol guides, as they will often suggest alternative imaging or alternative projections, depending on the pathology or clinical clinical question, or even the orthopaedic surgeon in question. Now you should try and look at the rationale for using MR, ultrasound, CT and nuclear medicine procedures. When and why would you use these different modalities? You might want to look at what advantages and disadvantages that these modalities have. Now, another good source of information is the Teesside University referral criteria and exposure documents that I gave you all during the lab sessions for CP1. You will find the list of alternative modalities for a range of clinical questions where general X-ray is not indicated. For example, nuclear medicine for bone metastases. Anyway, I'll say goodbye for now so that you can get on with the Blockbusters quiz. I hope that you have another lovely week in clinical practice. If you want to drop me a line to tell me how you are getting on in placement, just send me a tweet or send me an email as usual. As always, I really would love to hear from you all. So, in typical Bob Holner style, goodbye for now from us all.
Can I have an S please, Bob?
What S describes the position of a patient lying on their back?
Can I have a W please, Bob?
What W starts the medical abbreviation WBC, often used to indicate infection?
Can I have an E please, Bob?
What E describes the movement where the sole of the foot is tilted away from the midline of the body?
Can I have a P please, Bob?
What P is the elevated body temperature above the normal range of 36 to 37 degrees Celsius?
Can I have an I please, Bob?
What I is used to describe the radiographic baseline that connects the centres of the orbits and is perpendicular to the median sagittal plane?
Can I have a B please, Bob?
What B is the injury to the leg incurred by pedestrians when hit by a car?
Can I have a N please, Bob?
What N describes the bone that articulates distally with the three cuneiform bones in the foot?
Can I have a K please, Bob?
What K describes the normal convex curvature of the spine in the thoracic and sacral regions?
Can I have an L please, Bob?
What L is a soft tissue sign on a horizontal beam lateral projection of the knee that indicates the presence of fat and blood in the joint?
Can I have a D please, Bob?
What D is a lifelong metabolic condition in which the blood sugar levels become too high over a prolonged period?
Can I have a J please, Bob?
What J is the radiographic projection used to evaluate acetabular fractures or hip dislocations?
Can I have an F please, Bob?
What F is the bending of a joint in a limb that decreases the angle between the bones of the joint?
Can I have an A please, Bob?
What A is the last letter in the abbreviation of the orthopaedic procedure MUA?
Can I have an M please, Bob?
What M describes the black tar-like faeces associated with gastrointestinal hemorrhage?
Can I have an O please, Bob?
What O is used to describe the blockage of the bowel?
Can I have a C please, Bob?
What C is the angulation of the central X-ray beam towards the patient's feet?
Can I have a G please, Bob?
What G is the synovial ball and joint socket that allows the head of the humerus to articulate with the glenoid fossa of the scapula?
Can I have a V please, Bob?
What V is the highest point of the skull, formed by the frontal, parietal and occipital bones?
Can I have an H please, Bob?
What H means the vomiting of blood?
Can I have an R please, Bob?
What R is the study or treatment of conditions affecting the joints, muscles, bones and connective tissues?
N.